still to come, but first it's emerged that the private PCR testing company, which gave the all-clear to thousands of patients infected with COVID here in the West, has not been independently accredited. The government allowed private testing centres to self-certify rather than be independently inspected. Here's our health correspondent, Matthew Hill.
These labs in a science park in Wolverhampton are no longer working. Its operation was suspended last week after the UK Health Security Agency announced an investigation into why it took a month to identify it was giving incorrect COVID test results. Around 43,000 people in England and Wales, especially here in the West, may have been wrongly told their PCR COVID test was negative. Immensa Health Clinic was given a £220 million contract without any other competitive tendering, and today it's emerged that neither Immensa nor its founding company, Dante Labs, have been accredited by UCAS.
It is accepted practice for laboratories, private laboratories, to self-accredit themselves with the accreditation body, the UCAS, United Kingdom Accreditation Service. However, it is really important that they are independently verified and their processes are checked out by the UCAS service set up by the government. So self-accreditation has its limitations, as we have just seen.
The government had said they had to move quickly at the start of the pandemic to set up these labs, and that's why a system of self-certification was allowed. Immensa was set up by a DNA testing for fitness and nutrition company called Dante Labs. This is an area of health testing which has very little in the way of regulation. In September, the competition watchdog launched an investigation into Dante Labs. The Competition and Markets Authority said the company might not be delivering private PCR tests that people were buying in order to go on holiday.
These were tests from NHS Test and Trace, which means that they were done under an NHS contract and they were audited by the NHS and the UK Health Security Agency. And in comparison, the private market for travel tests is a Wild West. It's only the NHS contract that meant that they couldn't ignore it when the questions that were being asked by the public to the NHS and the Health Security Agency got so big that they had to look into it. We don't yet know how many people were really affected, and it may be many, many more than the 43,000 that have currently been admitted.
Immensa have said that they've carried out millions of tests successfully and will be cooperating with any investigation. Matthew Hill, BBC Points West.